Hello, thank you for joining us for Unite for Sight's webinar about how to best prepare for a career in global health. We have 900 participants in today's webinar, and we're thrilled to have all of you with us here today. My name is Jennifer Staple-Clark, and I'm founder and Chief Executive Officer of Unite for Sight. I'll introduce you to Unite for Sight and then review the webinar logistics, and then we'll hear from our expert panelists. Unite for Sight is a nonprofit global health organization that promotes high-quality care for all. We offer extensive global health and social entrepreneurship education programs. Our Global Health University program, for example, offers this free webinar series, including today's webinar. And we also offer 20 online certificate programs for students and professionals. And many students receive academic credit, as well as professionals who pursue the online certificate programs for professional development. And the certificate topics range from a certificate in global health and a certificate in global health research to a certificate in social entrepreneurship, in addition to 17 other online certificate programs. And we have another upcoming webinar on April 30th about marketing and communications to engage your audience. And we encourage you to listen to our many past webinars, as well as register for upcoming future webinars at www.uniteforsight.org/webinars. Additional educational opportunities for students and professionals includes participation in Unite for Sight's annual Global Health and Social Entrepreneurship events, which focus on responsible global engagement. And our 13th annual Global Health and Innovation Conference, which is the world's largest global health and social entrepreneurship conference, will be next April 2016 on April 16th and 17th at Yale University. And we just recently had our 12th annual conference this past March. So definitely save the date for next year's conference in April 2016. And the conference website, abstract submissions, and registration will be launched in early May 2015. And complete details can be seen at that time at www.uniteforsight.org/conference. We also have healthcare delivery programs that provide care to patients living in extreme poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are not otherwise able to access or afford care. And these programs are locally led and locally managed by the local medical professionals. And this collaboration has provided eye care to more than 1.9 million people by local doctors during the past decade, including more than 90,000 sight-restoring surgeries by the local ophthalmologists. Unite for Sight is the world's only organization that's a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities as volunteer opportunities for students and professionals. And participants support and learn from the local doctors in Ghana, Honduras, and India, as the local doctors provide care to patients living in poverty in villages, slums, and refugee camps. Participants, both students and professionals, learn from the local medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are not otherwise able to access or afford care. And the local doctors are phenomenal social entrepreneurs who design effective and innovative strategies to eliminate barriers to care. And now I'll describe for you the basic logistics of this webinar. We're so delighted to have all of you with us today. And we have 5 amazing panelists, and they have a wealth of expertise to share with you during this next hour. And note that Richard Skolnick, who was to be our 6th panelist, sadly can't be with us here today due to a sudden family emergency. Each of our other 5 panelists today will start by giving a 2-minute introduction about themselves, their current role, and their key piece of guidance about preparing for a successful and fulfilling career in global health. And then we'll dedicate the remaining time to your questions and answers. And we received hundreds of stellar questions already submitted from you, our audience, by Tuesday's question submission deadline. And we selected the most common and most thoughtful questions to ask our panelists today. We also invite you to submit additional questions in the text box on the left of your webinar screen, and then we will select additional questions to ask the panelists today as well. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GHUWebinar, and you can see that hashtag in the webinar visuals on your screen. Now we'll proceed to have our panelists introduce themselves in alphabetical order, and I'm delighted to introduce you to our first panelist, Kirk Allison. Kirk, please begin by introducing yourself, your background and current role, and your key piece of guidance about preparing for a successful career in global health.
Thanks, Jennifer, for inviting me. As mentioned, I'm Kirk Allison, and I direct the program in Human Rights and Health at the University of Minnesota. I ended up in public health and global health through health and human rights avenues. My background includes health services research, policy, and ethics. I teach a mixed undergrad and graduate course on global health relief development and religious and non-religious NGOs. And this is in the School of Public Health, and I teach in the medical school's Global Health Pathway and in its annual Humanitarian Crisis 3-day exercise. Now, for students, my advice is in seeking a career in global health, collect complementary skills, that is, learn to do more than one thing, learn a likely language, which could be French, Spanish, Arabic, depending on your regional interests, develop network connections, and choose for a fit an 80% position with a 100% organization rather than a 100% position with an 80% organization. Second, when considering a concrete context, major also on culture. If you do not have an experiential basis in the culture, attempt to build cultural competency from open sources and find a number of people within your community from the culture and context. Talk with them over tea and dinner. Foot the bill unless they protest 3 times. Learn their stories. Discuss what is important in building relationships within the culture and about what they have observed concerning whatever your background is interacting with that culture. Of course, there's a lot of diversity in cultures, and there are some center of gravities as well, so it's not simply a one-size-fits-all. When it comes down to it, global health is, in fact, local health for the people affected. And to borrow a line from Flannery O'Connor, somewhere is better than anywhere, and part of your task will be to integrate into that context. This does not mean sacrificing who you are per se, but rather building relational awareness. And when applying to an organization or for an opportunity, emphasize what you have done, what skills you can contribute, also beyond the immediate description, and how your values and intentions mesh with the organization and the opportunity. And of course, with 900 people here, we have people from all over listening in, and you can tailor that to your own context, both in terms of coming and going, sending and receiving. So thank you.
Wonderful. Thank you so much, Kirk. And Arachu Castro, if you can also please introduce yourself.
Hello, good afternoon. My name is Arachu Castro, and I'm a professor of public health in Latin America at Tulane University in New Orleans, where I have been working for the last 2 years. And as you probably guessed, I conduct my work, all of my research in Latin America and the Caribbean, and I have worked in different countries. I work with public institutions in those countries, namely the Ministries of Public Health, and I often work also in collaboration with international organizations. And I'm actually sitting at the World Bank right now in an office that they let me use. And my background is in anthropology and public health, and as such, all of my work, I use combined methodology using anthropology, epidemiology, and health policy analysis. And at Tulane, I also have I'm starting a new program on teaching and research on health equity in Latin America, and actually we will have an Institute for Health Equity in Latin America soon. And with the members of my team, who are actually students and some other faculty, we are conducting different research in always looking at what are, for example, the mechanisms through which different social and economic and health system factors impact health outcomes, and how oftentimes, for example, discrimination or weaknesses in the health system, how do those translate into the actual problems, not only in service utilization, but also in health outcomes. We are also, I'm starting a doctoral program on health equity in Latin America, soon meaning in August. And again, going back to my recommendations for a career in global health, I believe that what's very important for students is to learn as many technical skills as they can so that when they are going to look for an employment, they have something to offer, even if you do not have too much experience in the field. But number two, I always encourage my students to take as many opportunities as possible to work in the field. And when you're a student, that's probably a practicum or an internship, and that provides a great first experience and in a very safe environment because you're still a student. And one very important component is that it is very important to be able to navigate whatever country you're working on in a way that you feel comfortable and it makes people around you feel comfortable too. And by that, it's very important to learn the political economy of the country, the history of the country, and obviously the language. And I believe that's a very important skill to be efficient when you work abroad.
Terrific. Thank you so much. And our next panelist, Vanessa Carey, if you can also please introduce yourself.
Yes. Hi, everyone. Thank you, Jennifer, for having me. And I have to say hi to my old friend, Arachu, who I haven't talked to in a long time. Wonderful to hear your voice. So it's wonderful to join everyone this afternoon. So I am a physician at the Mass General Hospital. I'm also the Associate Director of Partnerships and Global Initiatives at the Center for Global Health there. I'm on faculty at Harvard Medical School, where I direct the program in global public policy and social change in the Department of Global Health and Social Medicine. And then, but my biggest job really is that I'm the co-founder and CEO of an organization called SEED Global Health. And what SEED does is we send doctors and nurses abroad to be medical and nursing educators, to embed as faculty in public health training institutions in resource-limited countries. And we are flagged, and we do this also we support the volunteers in the field, but we also provide essential debt repayment to ensure that volunteers who want to serve are enabled to serve and they don't have any kind of financial barrier to being able to do so. And so we'll offer up to $30,000 for each year of service. We currently work, and our flagship program is the U.S. Peace Corps. So we do this in partnership with the Peace Corps. The vast majority of our volunteers go as Peace Corps volunteers in the true tradition of service and diplomacy, but they really spend the year teaching, training, and helping to build up the health systems and the human resource development in the countries where we work. We work in Tanzania, Malawi, and Uganda right now, though we're about to expand to a West African country that's been Ebola affected and to another Southern African country that is high HIV prevalence. In our first year, we trained close to 3,000 students, trainees, residents, doctors, nurses. We taught over 32,000 work hours, and we introduced 85 different courses or modalities, and we're actually in the process of doing our M&E for our second year now. I think the most important thing lesson for getting involved in global health work, and I think there's two, and they've both been said. For me, the most important, though, is that if you are going to these countries, you have to go with humility and you have to go as a true partner. And that means listening, observing, understanding the culture of where you're working and being patient. Don't come in with an attitude that I'm from, a place that knows how to do this, because every solution actually is very contextual, and needs to be very specific. And I think that that will make you more effective if you spend the beginning of your time anywhere observing and learning and just absorbing and getting to know your peers as colleagues, friends, and humans first. And then I think what Arachu says is a huge ring of truth, is that if you take the opportunity to get a skill set as you can, it's not mandatory, but you will find yourself more readily able to sort of apply yourself, and it might be easier to find a niche or at least a springboard from which to do your work. And I think that it's always appreciated because many organizations, do need various skill sets to plug in. I know we do. We need a vast array of different skill sets. Some are taught, some are more organic, but that can be very important. Thank you.
Well, thank you so much, Vanessa. And our next panelist, Bob Lawrence, if you can also please introduce yourself.
Thanks very much. A pleasure to be with all of you. I guess I'm probably the oldest member of the panel. I had a wonderful experience in 1963 as a fourth-year medical student doing a tropical disease clerkship in Bahia, Brazil for 6 weeks, learning about parasitology and being introduced to some of the challenges of delivering good clinical services in low-income, low-resource settings. I then went on to general internal medicine at the MGH and 3 years with the Epidemic Intelligence Service at the CDC, 2 years of which were spent living in El Salvador doing malaria epidemiology throughout Central America. I had some early exposure to human rights abuses, and when I was invited to return to El Salvador in 1983 at the height of the Civil War, I spent a week investigating the disappearance of 13 doctors and medical students, followed that with a trip to the Philippines investigating the death of 2 doctors at the hands of paramilitary groups. And before I knew it, I was being drawn in with Jonathan Fine to co-found Physicians for Human Rights in 1985, celebrating our 30th anniversary this year. With PHR, I participated in investigations in Chile, Guatemala, South Africa, Egypt, Czechoslovakia, in addition to the earlier ones in the Philippines and El Salvador. I practiced for about 20 years in the Boston area with a lot of refugee patients from the civil wars in Central America, the Horn of Africa, and was regularly exposed to some of the challenges of global health of people seeking refuge in the U.S., which is another important way to get exposed as a student or a young health professional. There's a very large refugee network throughout the United States seeking to provide service to those who are attempting to gain asylum. Then I spent 4 years directing health sciences for the Rockefeller Foundation with grant-making activities in Asia, Africa, and Latin America, and was exposed to a lot of work being done in the agricultural sciences and environmental sciences domain as they impacted on health status. So when I moved to Johns Hopkins 20 years ago, I started the Center for a Livable Future, and my work has focused on food security and the problems nationally and internationally of providing adequate nutrition, especially to low-income populations. I guess my advice about preparing for an international or global health, life can only really be understood looking back. I have no idea how I ended up in all these places, and yet you have to live life going forward. So seize opportunities, be, as the other panelists have said, be open to different cultures, different experiences. I think for me, living for 2 full years in Central America was absolutely crucial. I only began to get a feel for the country and for the challenges after being there a year or so. So short-term experiences are wonderful, but if you really need to get embedded and understand culture and the political dynamics or the political economy, as Arachu said, I would recommend seeking that kind of experience too.
Wonderful. Thank you, Bob. And our final panelist, Marie Martin, if you can also please introduce yourself.
Thank you, Jennifer. It's wonderful to be here and great hearing all the stories and advice from the other panelists. My name is Marie Martin, and I'm the Assistant Director of Education and Training at the Vanderbilt Institute for Global Health, where I also co-direct the Global Health track for our Master of Public Health program. I have an academic background in international education and policy, and have been developing curriculum and academic programs for about 15 years now, both in the U.S. and abroad. And my work focuses on building human capacity to improve health outcomes in low-resource settings. And I seek to build capacity on 3 distinct levels. at the individual student level to be more effective practitioners and leaders in global health, acquire durable competencies, and develop a strong toolkit, much like the other panelists have mentioned. At an institutional level at Vanderbilt, to build high-level training programs in global health, enhancing and expanding our own expertise in a number of different areas. And a low and middle income country level, building capacity on the ground to effectively tackle health issues domestically, opening up new possibilities in training, research, and ultimately disseminating knowledge. So my advice, I think that I'll echo what the other panelists have said, and they're all such important and valuable nuggets to take and pack away for your journey into global health. But I would say first ask yourself three things. One, what are your interests? Do you enjoy working with people, data? Are there clinical aspects of the field that interest you, programmatic, a region of the world? Figure out what your particular interests are. And two, what are your hard skills? Like others have mentioned, do you have skills in data analysis, program evaluation, budgeting, and so forth? And lastly, what are your soft skills? Intercultural communication, leadership, and others. And then step outside of yourself to ask, what does the global community need? So to identify where your skills and interests can meet a great need on the ground is an important starting place for finding your own niche. And I'll borrow words from a famous novelist and theologian, Friedrich Buechner, who encourages people to find a place where your deep gladness meets the world's deep hunger.
Excellent. Thank you, Marie. And thank you so much to all of our panelists. As you heard, they all have such a wealth of expertise and guidance to share with you today. Now we'll proceed for the rest of the webinar with the questions and answers. As mentioned, we received hundreds of questions in advance from you, our audience members. And if you have additional questions, please post them in the text box on the left of your webinar screen so that we can include some of your questions from this afternoon as well. We'll begin with our first question for Arachu. What was the most challenging issue that you experienced during any part of your career, and how did you navigate it?
You know, I've had to think very hard about what that would be, and I think that most people would agree with me that the most difficult parts sometimes are it's hard sometimes to work with certain people. And of course, a whole project, a whole endeavor that can have an impact on a lot of people may depend on that relationship that you build with a small amount of other colleagues. And it is so important to try to understand where they're coming from, what are their goals, and even to listen very attentively and to try to put yourself in their shoes, whether they are policymakers or healthcare providers or the people who are going to benefit from all these different projects. And sometimes there are people that are difficult to work with, and that is not only in global health but everywhere. And I think that probably, if I can think of a couple instances where I had that issue and how I had to solve that, it's going back to what Vanessa said earlier. Hey, Vanessa, good to hear you. Is to be very humble and know that even if we would do things different, if we didn't have to work with people who are difficult, that we still have to accommodate other people's perspectives, even if we don't agree with them, and try to find common ground. So I think that applies to any job. But here in global health, we have the added complexity that we often work with people who come from various socioeconomic backgrounds, various places of origin, various needs, and various languages. So it's challenging per se. But I think that with a lot of patience, that's something that I have developed throughout my work, particularly working in certain countries. And it's very important to be very patient, to understand that what we have when you work, for example, in a university environment or in a U.S.-based institution, we create deadlines for ourselves. And oftentimes, our deadlines do not match the deadlines on the ground. And we may have to report to a donor about how much we have advanced in a project. And sometimes what we have to explain to the donor is, well, there was a political impasse in this country, and for this and this reason, I couldn't advance as much as I had predicted. And we never have to put our deadlines ahead of the deadlines of the countries where we work. So those are just some thoughts. Thank you.
Excellent. Thank you so much. And a question for Marie. How can job seekers ensure that they will be employed by an organization that is relevant, culturally responsible, and effective?
This is such a timely question since there are probably graduating students on this webinar who are actively searching for jobs in the field right now. So I would say do your homework. Create a list of criteria and then evaluate organizations based on that criteria. And the criteria may change or morph considering the context, but I would say that there are probably some central and foundational criteria that can guide you. One, is the organization guided by locally identified and articulated needs in the places it works? So does it systematically seek input from the community in that effort in a participatory way, recognizing that there is a shared process in identifying needs? Has the organization also developed durable, generalized trust within the community? And this often comes through organizations or individuals who've been working in partnership, true partnership with the community for a period of time. And they'll have track records of efforts towards improving the community and the environment, and usually you can identify those. But also even asking questions of how they seek to empower and educate individuals, the community, their staff. And then another criteria would be about progressive management. Is there diversity in the leadership ranks? Are stakeholders represented, local and otherwise? And are there transparent budgeting processes, and are they truly interested in sustainability of their programs abroad?
Perfect. Thank you so much, Marie. And a question for Vanessa is, how important are foreign language skills when pursuing a career in global? For those who are not multilingual, what other steps can be taken to make oneself more competitive?
Well, I think that this is an interesting question because there's actually, traditionally global health and public health is actually in French. So, if you think of the languages that are spoken most in the world, Spanish is, probably the most spoken language, but the language of public health has traditionally been in many ways French. And that's sort of the history of many things that had to do with post-war stuff and, even the UN, but mainly WHO and things that were based in Geneva, and that's really evolved now towards English. So most people speak English in the world today, and that has become the language of public health much more so of late. But that said, if you are really going to spend time in a country, get to know a country, and participate in a solution and to work with your colleagues, and understanding the local language actually is critically important. This can be very tricky also depending on where you work, because Uganda, for example, has 53 different dialects. And so I can teach Luganda, which is the primary spoken language in Uganda other than English. We can have our volunteers learn that, but then they're going to go to the north and suddenly, actually that's not a good example, they go to the south and they actually need to speak Runyon Kole. And that's a very different language, which can be, and so the dialect issue can be very tricky. So what we do with our volunteers actually is we put them through an intensive immersion and language course for them to learn the language. So even though they're spending the year working in educational institutions that speak English as their primary language, is part of the reason we chose there, and all instruction is supposed to be in English, they all report that there's often side conversations or follow-up conversations or informal learning that ends up happening in the local language. So in Tanzania, Kiswahili is often used, and though they go through an intensive language instruction, they have found that they don't still have enough to really understand some of the nuances or the cultural references that can be very important when they're treating patients. And so I think it is really important to make that effort. In this day and age, there are often manuals, handbooks, or some sort of guide to help you learn the language. You can hire a tutor. Spending time there, really pushing yourself to practice. Many actually, I know that Harvard actually has a lot of formal courses in some of the more, I mean this very sort of non-judgmentally esoteric languages, but you can also take some of them informally where there are people from those countries or those regions who speak them who are willing to teach you. And so you can seek those types of folks out. I will tell you, I find it a great challenge because I often, working in many countries, I don't really often get past the please and thank you in the language, and I always feel very frustrated that I can't have a more meaningful conversation because I also think it goes a long, long way towards bonding if people see that you've made the effort to learn their language.
Thank you, Vanessa. And another question for you regarding humility, which we've been discussing quite a bit during this webinar thus far. How do you make that come across in a job application?
Humility? I just want to make sure I heard you. My connection's not great. You said you're asking about humility and how you get that across?
Yes.
So it's a really interesting question. I mean, we've been in the process of hiring some folks for, we've grown tremendously in the last 2 years, and I think that I honestly am not sure I actually have a great answer about how one conveys it because you either are or you aren't. So it's hard to, I think it's a willingness to learn. I think it is a willingness to be enthusiastic and be a part of a team, to recognize that you are part of a bigger solution, that you in and of yourself can't work in isolation. And I think it's really conveying an understanding of the fact that you're working for the priorities and the needs of your partner and your partner country. And that sometimes, frankly, is missing in people that I've interviewed in global health. They're doing it because they're enamored by travel, or they're doing it because they love the feeling of helping other people. But it doesn't, but it's more about what they're getting out of the experience and less about what the end game is here for the folks that we're working with on the ground. And I think that keeping a really healthy sense of, what the totem pole is here is important, and understanding that, we are really, we're there for our partners, we're there for their priorities, and that means listening to them. And I think the ability to understand that and convey that in interviews can be really important. And also I think having the courage to say, I don't know, I'm looking forward to learning that is also important, because none of us, I think we all want to be a part of a team where people are thinking about solutions together. And I think that can be an important piece as well.
Thank you so much, Vanessa. And a question for Arachu, what recommendations do you have for students and young professionals trying to gain experience working abroad? Oftentimes, organizations want past experience working in the field, but there are few opportunities to newly gain experience, which leads to a catch-22.
Yes, I probably answered the question by encouraging students to do as many internships or practicum as they can while they are in school, so that when they complete their degree, they can, even if it was for a short amount of time, they can still say, well, I did work in this country. And if another, as I was mentioning, very important aspect of your training is to gain skills. For example, if I have a student who comes to me and says, could you have opportunities for me as research assistant? I want to see what skills they can offer to me because, for example, if I need someone who's strong in quantitative methods for a project and I see that the student already has taken certain courses in quantitative methods, I will be valuing those skills. if I see that a student has already had experience working in a certain country or area or has worked for another organization, I would try to value those skill sets that the student can bring. I know it's a catch-22 sometimes when organizations expect experience prior to joining them, but that's why I think that during your degree it is very important to gain as much practical experience as you can in addition to the courses that you take.
Thank you so much.
And also I was also thinking that maybe the first job or the first few jobs are not exactly what you are expecting in 100%, but if you can see that as an extension of your education, where you're actually gaining experience and that experience is going to take you later on where you want to be, that is also very important. It's always hard to find a job that is perfect, and I think that particularly at the beginning, we have to be mindful of the lack of experience of recent graduates, but at the same time, try to see job opportunities as a stepping stone to take everyone where they want to be next.
Great. Thank you so much for your insight. And Kirk, what advice do you have for those seeking a career in global health academia?
I'd say a couple of things. One is, if you're interested in global health and academia, then you should think carefully about how you're specializing and the skill sets that you're accruing. So if you're in medicine, perhaps tropical medicine, internal medicine, if you're perhaps trauma skills, probably not interventional radiology. Though I did have a student who was a physician assistant in interventional radiology who took my courses in global health, relief and development, and health and human rights. And I ended up having him go to Tulane because he was interested in tropical medicine and tropical areas to do some additional education there. So I think that's important to really think carefully about your disciplines. The second is I'm always for adding public health skills and dimensions depending on what your other skill sets are, whether epidemiology, community health, education, program design, or evaluation. If you're on the side of nursing, nursing and public health, nurse practitioners, nurse midwifery, these sorts of things can be very, very helpful. If you're in academia, academia has its own culture and it has its own reward systems, and it may or may not as effectively reward global health engagements as in other areas, because global health engagements can at times be messier in terms of research, messier in terms of being able to control the environment or act within the environment. And so you need to be in an institution that supports that kind of endeavor and actually rewards that kind of endeavor. It's important to find a good model or good colleagues and mentors if you're earlier in your career and build relationships to learn both sort of strategic elements in terms of, let's say, designing research projects and a research trajectory that will carry itself over time and will be conducive to building relationships with communities over time, and also in terms of just negotiating the pragmatics of the academic culture. Find or develop also cross-disciplinary partners within your institution and beyond your institution. And in my own institution with the School of Public Health and the Academic Health Center, there's probably something similar to the Center for Global Health and Social Responsibilities at the Academic Health Center level, and other areas that are doing work in, say, food security and other areas across the university. Oftentimes there's a lot of global health silos, and trying to integrate and work with colleagues across is important, and also outside the institution. I think at times it can be easy to get a little bit trapped into the official partnerships. Every institution, every school likes to have its official partners in another country, and you can work within those for research opportunities and longer-term relationships, and oftentimes they're very excellent for placing students with internships and having continuity and even having places for people to stay. But one should also think beyond those relationships, because bureaucratic relationships sometimes break down, whereas you may need to have opportunities and relationships for pursuing particular kinds of research. Final thing is sort of think whether you're more on the development side, the long-term health side, or maybe on the relief side. And if you can even have, obviously in global health, there's certain things that are going to be around: malaria, tuberculosis, HIV. But suddenly we had Ebola pop up, and very intensely, and huge amounts of resources and skills and responses, and some good and some not so good. Those can happen very quickly, but if you're doing research in areas of, let's say, more on the relief side, those are very dynamic situations. And finally, you have to think about global health when you're doing that, about the research ethics and the issues of things like informed consent and of data and what that means in fluid context, also perhaps working with populations and people who are not necessarily literate or who are traumatized, and all of the things that go into that. So look for the strengths in your institution, look for mentors, look for support, and try to build a platform for research and relationships that are longer term wherever possible.
Terrific. Thank you.
Oh, I should have said grant writing and publishing. Of course, you need to do that. So thank you.
That's great. Thank you, Kirk. And Bob, what are the best ways for a student to make connections and get involved in global health while still an undergraduate or a graduate student?
Well, I think the responses that Arachu and Kirk had tie very nicely into this. While you're a student, either health sciences professional student, taking electives and beginning to form your own networks and contacts is really important. And then depending on the nature of the health sciences center where you actually are in training, take advantage of your fellow students. We have students here at the Bloomberg School of Public Health from about 80 countries around the world, and our faculty are involved in even more countries with projects. And they're always visiting fellows in different clinical disciplines. There are interest groups, Latino interest group, African health interest group, lots of ways to build these bridges while you're a student. And then as you begin to actually participate in short or long-term assignments, maintain those contacts. There's nothing that a person living in, fairly isolated hardship posts appreciates more than to stay in touch by email or Skype or the old-fashioned snail mail with people that have spent time with them. I have contacts and colleagues in other countries that just seem so grateful to exchange information, and I forward an interesting article or something like that because they don't have access to a big medical library and so on, they're always very appreciative of that. So look for opportunities everywhere to build those connections and then maintain them. It takes constant effort to do that, but it's well worthwhile.
Excellent. Thank you, Bob. And another question for Vanessa. What suggestions do you have for medical students and doctors who are interested in global health? Are there specific specialties that are most useful for those looking to make an impact in resource-poor settings? And what is the best way for medical students and doctors to ensure that they are engaged in locally responsible healthcare delivery that works within the existing local healthcare system?
Those are great questions. I'm actually going to push back just a little bit on the idea of, sort of choosing a clinical specialty that might seem better tailored, because the truth is the needs in these countries and places are infinite. They're actually no different than what the needs are in this country. And there's a real shift in the epidemiological pattern of disease now, where it's not just infectious disease, HIV, TB, and malaria, but there is, this movement to non-communicable disease. You're now seeing malignancies that'll be the third leading cause of death globally and in developing countries. You have cardiovascular disease as the leading cause of death globally, and now actually in sub-Saharan Africa, it's about to surpass HIV. Chronic lung disease is a huge issue. You have diabetes, renal failure, the change of Western diet. And I actually have known the radonc department at MGH is getting involved now in doing some global health work in Botswana. They're helping to create a radiation oncology center of excellence based there for serve Southern Africa. Certainly the specialty you choose will be easier or harder to find opportunities. I think that is a truth, but I think you really can pursue a career in global health in any specialty. I think you just have to be willing to maybe do a bit of a steeper uphill climb to do some of the more particular specialties. But see, Global Health just sent an orthopedic surgeon for a year. We've sent a pathologist for a year. We have a pediatric anesthesiologist in the field now. We have had a psychiatrist. I mean, so there's really, I think, opportunities in anything. The key, I think, as a physician is to make sure that you really adhere to that idea of to do no harm. And it is very easy to do harm if you go practice clinically in one of these settings, if you're not part of a structured program and you don't recognize your limitations. And I think a lot of folks get in a mindset of, well, I'm the only option, and therefore I should just go ahead and do this. But sometimes you're doing a procedure that you're really not qualified to do is actually worse than not doing the procedure at all. And I think that people need to have a very healthy understanding of their limitations and a really healthy respect for the patients that you're caring for. Because, yes, the resources aren't great, but they deserve, to be cared for by somebody who's trained to do a particular or to care for them within a certain area of expertise. And I think that the way that can be achieved is really by being a part of programs that are structured and that or creating. I mean, I took the route of creating a program, but I think ensuring that the program that you're part of or the work that you're doing is really well structured and is based off of lessons learned, and that it is about building the capacity of where you're working and not just as necessarily providing care. Now, there are some exceptions. I mean, you can easily go in and do retina surgery or cataract surgery and fix a lens. But I think that, and we've seen this, especially with our partners that we're on the phone with right now, that, there's capacity building that can happen within that as well, which can be critically important. So I think that those are really important ways to get involved, because also if you're going to be able to participate in this work and you can only do it for 6 months or even 1 month, you want to know that your efforts are not going to just blow away in the wind, but are going to be captured in some way. And being a part of a bigger program where you plug in allows your efforts, your energy, your creativity, and what you can offer to be better captured, better applied, and to be more sustainable. And I think that one thing that is also really important to think about is the time frame that you're there, because it takes a while to get to know where you're working. It takes a while to understand the context. It takes a while to understand your partners. And we see this in our volunteers. You talk to them in November, and they're miserable. They think, God, I can't do anything. Why am I here? Nothing I'm doing is sticking, and I don't really understand the reason. You talk to them by February, and suddenly it's all gelled because they've been able to understand their community and how to work in a way that suddenly they're really productive. And it's so cool to watch because they suddenly really see the impact of what they've done. And so time makes a big difference too. So there's got to be a patience, I think, with this work, which I know I have always struggled with, but is important.
Thank you so much for your excellent insight, Vanessa. And Marie, is an advanced degree necessary to work in global health? Is it advantageous to continue to pursue additional degrees, or can elective courses and quality global health experiences be enough for a career in global health?
Thanks. This is an interesting question. I think we find ourselves in an interesting place right now because we do know that skills and competencies can be gained in different kinds of venues. They can be gained in the field, in the classroom, in both, and even increasingly on the internet. And so there is a fantastic democratization of resources that we're experiencing now, and case in point are the modules that are part of the Global Health University for Unite for Sight and others, and so there really is access to information that wasn't historically available. But there certainly remains a very strong expectation for an advanced degree. The field of global health has changed significantly. It's arguably more professional, more specialized, certainly more competitive. And so considering credentials and training is really vital as you're thinking about your next step. And especially if you don't have the skills that you need to be effective, then concentrating on developing new competencies or enhancing existing skills to help you contribute in a meaningful way can be attained through really good programs. And that doesn't have to be Masters of Public Health programs. I think that all of us are speaking to this, and we come from interdisciplinary backgrounds, but there are many different needs in global health and many different ways that you can create your own niche. Mine, for example, is in education and training, and also in policy, so my educational background is there. And there's some unique opportunities that have arisen because of that, and some opportunities to really affect change in a meaningful way. So consider that. And then also, I think this also speaks to that catch-22 of how do you gain experience if you don't have experience, but you need experience to get it. And advanced training often allows you the opportunity, as people have mentioned on this call, to have internships, practicum opportunities, even just work with mentors as a student, where it's easier to facilitate those relationships and take advantage of opportunities that might present themselves. So I think that's, there are a lot of different ways to answer this question, but I would say that the reality is that some kind of training is to be effective and to do no harm, as Vanessa, and also to think about ways that you can partner in meaningful and sustainable ways with communities.
Fantastic. Thank you so much, Marie. And Bob, how is a Master of Science in Global Health viewed versus a Master of Public Health? Also, is a certificate in Global Health beneficial, or is a master's degree most highly valued?
Well, to Marie's point about credentials, I think around the world today, probably the Master of Public Health is the most universally recognized. But I would say it really comes down to content, and a certificate matched with other professional training can serve people very well, and the newly emerging master's programs in global health. Also, there's been earlier discussion about the fact that the needs are great, and if you happen to have a personal passion for epidemiology and biostatistics, and you take additional courses in that while you're doing a master's in global health or a master's in public health, there are going to be a lot of NGOs and a lot of host country programs that are going to welcome people with that kind of expertise. Similarly, if you're into the social and behavioral sciences, again, I think the important thing is to match your own personal passion with the content available in the different programs. What I see in places where people are now beginning to have a greater familiarity with the kinds of training opportunities available is that they're really interested in the individual and in the specific tools and skills that that person has to bring to the problem at hand rather than the kind of training they've had.
Thank you so much, Bob. And Vanessa, what do you look for as you hire other leaders and managers for an organization? How do you ensure that a prospective employee will be the right fit? And what are common pitfalls that job applicants to global health organizations can work to avoid?
That's another great question. So I think it's interesting. I'm actually reading a book about leadership right now that a colleague asked me to read to give some comments on, and I'm learning a huge amount from it that has actually started to guide my hiring to some degree. And I think that when I look for folks, the first and foremost thing that I look for in somebody who's going to come work for us is a passion for what we do. And not an understanding necessarily of all of our nuts and bolts, but an understanding of the vision and what we're trying to achieve. And I think that when you go into an interview or you look for a job, it is really important to hired. You need to understand, as much as you can about the organization and who they are and what they're doing, and have questions about how they do things, because I think I love to see that people are thinking about us, even if it's something that maybe, they could have found on the 80th subpage of our website. It's important to me that they're asking the questions, because it means that they want to add value, and it means that they are interested enough in what we do that they're willing to dive in. And that's probably the most important thing for me when I interview someone. I also look for people who, and I think that also speaks to somebody who is a leader in the sense that they're being proactive. They're thinking about the organization in a way that if they were in my shoes or in my co-leadership team's shoes, that they would be asking or wanting to think about. And I'm not saying that if you're applying as a program manager, I don't expect you to solve the political battle I'm having with, ex-partner, but it's in the idea that, you're thinking about within your job and the job that you're applying for, how you can add value. Can be really important, because it means you're willing to take ownership for your work, and it means that you're willing to take ownership for the success or failures of the organization. And I very much have an approach that we're a team, and we are all responsible for how it works or doesn't work. And I want everyone to feel that ownership for the organization as well, and for what we're doing and for our mission. And so I think that can be a really key piece of the process. I think that I am less worried about whether or not an applicant has a master's in public health, or, it matters to me more sort of what their experience is. And they don't have to necessarily have experience in global health, but if they have experience really, putting together programs, doing reporting on that program, and, being able to organize a number of moving pieces to keep the team informed and to, create a successful project, that to me speaks to a core skill set that's going to add a contribution. Certainly experience in the field does matter, and it's helpful, because you understand that folks are going to be able to plug into the work that we're doing without, with a sort of a mutual approach to the work, and sort of understand some of the challenges of working in the field. So I do encourage people to have that, and I think that, we have a program manager who had no experience in global health, and when she started with us, and she's outstanding, has really been the lifeblood of keeping our organization going, and I think it reflects all her skills that she brought to the table that we very much needed. Those are the things that I think. And then, one of the things I look at is for how I get along with this person, because sometimes we're going to be working really hard, and I want to know I'm going to be laughing with this person. I want to know that we're going to be, they're going to be able to roll with some of the punches, that they're going to, be flexible, because I think that that's often what we get challenged with in this work. And so some of it is a personality vibe, and I have people on my team interview. So I'm not the only interview. I have other folks on the leadership team interview, and then whoever in the organization would be working with the person I'm interviewing, I have them too. So I was in the process of hiring someone who's going to be a manager to a couple folks in the office, but I had the people who are going to be managed by this person interview as well, because I want to know that they're going to like this person that they have to answer to. And I think that hearing all those voices, and they, provide important feedback. So and I think it's important for you to realize, too, that if there's not a good connection with the people that you're interviewing in the organization, that may not be a place that you're going to be happy either. So it's just as important for those of you who are interviewing for a position to feel like it's a place that you want to work and would have a good time and be able to flourish.
Terrific. Thank you so much, Vanessa. And a question for Kirk: what key guidance do you have for those looking to make a career shift into global health from a different?
Well, one thing I would say is look at your present skill sets and experiences and see how they transfer to the global health context. Depending on the area of global health you're interested in, you may have a lot more already on board than what you may think. Secondly, if you're thinking organizationally, how does this mix with the organizational needs and contexts and roles? We've had a lot of discussion about whether it's good to have an MPH or an MS or certificate programs. If you're a professional that has significant experience, it may be that what you need to add are the skills and not so much the letters behind the name, and to really work on adding those skills. In the case of public health, I know there's some very good undergraduate programs in public health, Johns Hopkins being one. But most people come into public health from somewhere else, and whether it's in biostatistics or epidemiology or something else, we have a lot of people from anthropology and other disciplines. So this is something that's quite common in public health. And one thing that hasn't been discussed about very much here would be if you're a professional that's been working for a while, particularly if you have a family, check with your family on the decision towards shifting into global health. It may be that you're planning to relocate. The question is, what about them? What do they think about it? What are your commitments? Would they be able to relocate with you? Are you going to be solo? Are you going to be 6 months in the country, 6 months out of the country, and these sorts of things? So I think it's important to think about the broader relational context that you have as well as your skill sets.
Thank you, Kirk. And that brings us to our final question, which comes off of what you were just discussing, Kirk. For Marie and Bob, if we can have both of you discuss your insight, what are your suggestions for managing the work-life balance while pursuing a career in global health? Perhaps, Marie, if you'd like to begin, and then Bob can add additional insight.
Sure. I kind of want to laugh because I wonder, is there such a thing as a work-life balance? No, but I certainly appreciate the question because we certainly need to have honest conversations about it and what it means for those of us working in the field, both men and women. So I'll appreciate what Bob has to say. I'll speak to this topic as a woman at least because it's not uncommon for me to see my colleagues, my female colleagues, begin dropping out of the workforce because of the demands of raising a family, working full-time, traveling abroad. They just appear too great. So I think that there are a couple of recommendations or suggestions that I might make that certainly others could contribute to as well. But I would say, one, seeking out a flexible, supportive work environment, a place where you can advocate and others advocate for your protected time, where there are thresholds that are established, where there are opportunities for professional development, and also being realistic. So recognizing that your life is a series of seasons, and you might not be able to take on in one season what you could in another. But it's not unrealistic to imagine that your family becomes part of your life abroad if you choose to work in a global health setting abroad, or if you're working domestically on global health issues. There's certainly so many different models for work in global health, and you just need to be realistic about which one best fits you and your family. And then make sure you have adequate support. That could be support from your colleagues, support from partners that you have, just making sure that there are professional and personal resources for you. Taking time out for yourself, and this is for men and women, because working in global health can be emotionally draining, and you can't help others if you're completely depleted yourself. So having some space to talk about those burdens and also the opportunities. And then lastly, I'd say don't give up. It's not all or nothing. Balance is elusive, and it might not be achievable, but it's a great goal. And there are so many needs and so many different ways you can be a part of improving the human condition globally. And so sometimes it just takes some intentional thought as to how you fit best in that scenario.
Well, I'd like to build on what Marie just said, and also Kirk's comment about being sure you engage your family in all these decisions. I think the idea that there are different seasons and different opportunities is really important. When I went to live in Central America for 2 years, I had a very young family. In fact, I had a child who was born in El Salvador. It was a great experience for my wife, who worked part-time as a nurse in one of the community health centers in San Salvador. Our oldest child still looks back with fond memories of becoming bilingual, and he went on to learn Japanese later on and was convinced that it was his Spanish background that allowed him to take on a third language. So lots of really rich opportunities for balancing work and family at different times. Later on, I think it would have been impossible to do a lot of short-term relocation of family. I have colleagues here at the School of Public Health who have had teenagers spend a couple of years living in a low-income country, going to the local international school, and having their entire lives shaped by that. I've also had people who have suffered by having to have their children return to the U.S. for education while they stayed on to finish up projects. So each situation is likely to be quite different, but I think being really open and honest with those who depend on you and your family and your close circle of friends is critically important, and allowing them an opportunity to sort of be vicariously appreciative of what you're doing, and that has been, in my personal case, a great part of a strong and happy partnership with my spouse.
Thank you so much, Marie and Bob, and thank you to all of our phenomenal panelists and for all of the insight that you shared today with our many webinar participants in the audience. Thank you so much again to everyone. And this concludes today's webinar.